the rate of infection is going up. It is spiking. The apex is higher than we thought, and the apex is sooner than we thought. That is a bad combination of facts. So slow the spread. We'll still keep doing everything we can, but it is clear that we must dramatically increase the hospital capacity to meet that highest apex. And we have to do it very quickly. Again, the apex could be here in as little as 14 to 21 days. And you're talking about a very significant logistical, operational movement to increase that number of hospital beds and do everything that you need to do related to the increase in hospital beds. There are three elements that are necessary to increase the hospital capacity. First are obviously the availability of the beds. A bed without staff is virtually useless, and a bed and a staff without the right equipment is virtually useless. So you have to complete all three at the same time. As far as beds, we have told the hospitals, I'm going to speak to every hospital administrator today, hospitals must increase their capacity by 50%. The goal is to ask them to try to increase it by 100%. Remember, we have 53,000 beds. We need 140,000 beds. Even if they did increase it by 100%, you'd only be at about 100,000 beds. You need 140,000 beds. Emergency hospitals like the 1,000-bed facility that's being built here will be helpful. The emergency hospitals that we're building at Westbury and Stony Brook and at the Westchester Convention Center will be helpful. But they're nowhere near the number of beds that we're going to need. I have no problem using the dormitories all across our state campuses, our CUNY campuses, our state university campuses. I'm speaking to hotel owners about taking over their hotels to put patients in. I will turn this state upside down to get the number of beds we need. But we need the staff for those beds. And we're calling and contacting all retirees in the healthcare field. We're calling all professionals in the healthcare field, whether or not they work in a hospital. They can work in an insurance company, a clinic, or whatever. But we want to enlist as many staff as we can and as many backup staff, because healthcare workers will get sick. And this is going to go on for weeks, and you can't ask a person to work for 14 days consecutive or around-the-clock shift. So we'll need a backup reserve staff. And equipment, masks, PPEs, and ventilators. And of those three, the greatest critical need are ventilators. Now, ventilators, you say ventilators, nobody really knows what you're talking about. The people who are going to come in, the people who will have acute needs, these are people who are under respiratory distress. They need a ventilator. The ventilator will make the difference between life and death, literally, for these people. This is a piece of equipment that in the normal course of business, you don't have a need for high levels of ventilators. And our hospital system has about 3,000 or 4,000 that has always met the need. This is a dramatic increase in the number of ventilators that you need. We have been working around the clock, scouring the globe. We've procured about 7,000 ventilators. We need, at a minimum, an additional 30,000 ventilators. You cannot buy them. You cannot find them. Every state is trying to get them. Other countries are trying to get them. The capacity is limited. They're technical pieces of equipment. They're not manufactured in 2 days or 4 days or 7 days or 10 days. So this is a critical and desperate need for ventilators. We're going so far as to trying an experimental procedure where we split the ventilator. We use one ventilator for 2 patients. It's difficult to perform, it's experimental, But at this point, we have no alternative, so we're working on this experimental application. Picture 2 hospital beds, 2 people in beds, 1 ventilator between the 2 of them, but with 2 sets of tubes, 2 sets of pipes going to the 2 patients. Again, it's experimental, but necessity is the mother of invention, and we are working on this as we speak, because life is options, and we don't have any other options.